Thank you very much indeed, Charles. Well, at the end of every summit such as this, there is a call to action, and this call to action comes from the CEO of UICC. Please welcome Dr. Cary Adams.
Thank you, Tanya. Before I do the call to action, perhaps we could just have a round of applause for Charles Goddard, who's done some tremendous interviewing this afternoon, and I know how difficult that is, so thank you very much, Charles. You've conducted the sessions really so professionally as usual, and it's a pleasure to work with you. And Tanya, also thank you for being here as well. I know that you arrived at some ungodly hour this morning, and you've had a cold as well, but you still managed to get here and to support us, so thank you very much. Less than 1 month ago, governments met in New York at the UN high-level meeting on UHC to agree a plan for achieving UHC in every country globally. The political declaration on UHC adopted there is an important step forward. For the first time, governments around the world have recognised how important it is to deliver UHC, including accelerating efforts to tackle the growing burden of NCDs, which includes cancer. This was yet another recognition that cancer and the other NCDs are a global threat to health, development and equity. But while this is important, it is the first step on a much longer journey. We've seen from the political declaration NCDs that these documents provide the global political framework, but we need to build a movement to drive action. Leaving no one behind must be our rallying call if we stand a chance of achieving health for all by 2030. So looking ahead at the second high-level meeting on UHC, which will take place in 2023, I can see three areas where our community can drive action and change. First, we need to see governments fulfilling the commitments they have already made. We did not start the journey to UHC on the 23rd of September. Instead, we are building a strong foundation. We have the action plans, resolutions, and technical recommendations we need to significantly curtail the global cancer burden in the future. We know what to do, and thanks to many of you here today, we have the knowledge and the evidence that can drive that policy forward. What we have lacked so far in a comprehensive approach is to turn these global commitments into action. We have a target of 80% access to essential medicines and technologies by 2025. However, as we've discussed throughout today and yesterday, countries are struggling to reach this. Effective action starts with a plan, as Princess Dina has said yesterday and today. And as of 2018, I'm pleased to report that 81% of countries have cancer control plans. One could argue about the quality and their funding, but we are in a better position now than we've ever been. These set out the key services, indicators and investments needed to deliver comprehensive cancer control and must guide the prioritisation of interventions for UHC for each particular country. And while delivering UHC is mainly in the hands of governments, as we've all heard, we all have a clear role to play in driving national discussions and working in partnerships to design and deliver UHC. And I take on board the comment made by Dr. Wahid about the importance of the civil society, particularly in low and middle income countries. Secondly, we need strong health systems that are built around people and not diseases. As we heard from the panel earlier, we cannot go down a particular drug or radiotherapy. It's about health systems built around the people and not the diseases. Successful UHC can only be achieved with stronger health systems that can deliver the services patients need as people, not as diseases. But our needs aren't unique. The building blocks we need, access to accurate data, trained health workers, access to essential medicines, vaccines, technologies, and diagnostics, can help to build stronger health systems for all. The policies and programs to shape the environment people live and address the social determinants of health benefit all, enabling us to build bridges beyond the cancer and NCD communities. As we heard, is cancer the Trojan horse of the health system? The investment we need in health promotion, prevention and early detection remain the most cost-effective ways to reduce the burden of cancer, other NCDs and communicable diseases, and ensure that people can live in the best health possible. We are seeing governments take up this challenge to build strong health systems, but we need the voices of patients around the table from planning through to evaluation to ensure that people are at the centre of these efforts. Thirdly, we need all stakeholders to invest, which is why the World Cancer Leaders Summit includes all sectors of society, because we all have a role to play. Governments have committed to invest an additional 1% of their GDP in health to support UHC, and this is a huge step forward. If this is achieved, it could unlock an additional $800 billion for health every single year. But we cannot rest on our laurels. We will need champions amongst governments and coordinated advocacy by civil society to see this pledge realised. For low-income countries, even further catalytic support will be required to kickstart investments in cancer and UHC to deliver on our global vision, and so we must look to all stakeholders to play their part: bilaterals, international organisations, philanthropists and the private sector. Reflecting on this, we have come a long way in the last 10 years, but we have a number of major challenges ahead of us. We all have a role in shaping awareness and knowledge of cancer nationally. We are part of the conversation about cancer and the delivery of quality cancer services. The cancer community is willing and able to support governments around the world implement their UHC ambitions, including cancer as a critical component of UHC's long-term success. I wholeheartedly believe that we, the cancer community, have the expertise, the passion and commitment needed to make UHC a reality and ensure that every country steps up to ensure that no cancer patient is left behind. To each of you, I would say, let's take action now when we get back to our countries and our cities. So at the follow-up high-level meeting on UHC, scheduled in 2023, we have real progress to report on all countries around the world. Thank you.